Hi, my name is Thomas Cherian. I'm a specialist in liver disease. More specifically, I'm a liver transplant surgeon. I trained in England in King's College Hospital, London, and worked there for about 17 years before I moved back to India and moved to Hyderabad. So I used to be the National Director for Liver Transplantation at CARE Group of Hospitals. Before I started South Asian Liver Institute, which is a very liver specific or liver dedicated hospital in Hyderabad, where we look after all liver diseases and nothing else. What I believe is that nowadays there's so much of knowledge that we can only be expert in one thing. If we try to deal with too many things, then we are experts at nothing. And so today I was asked by doctor's advice as to what's going on, doctor. There's COVID for the last 1.5 years. What's happening in the world of liver disease? And I was saying that there is no doubt that COVID and Corona has caused immense suffering, unbelievable number of deaths and illnesses in the country, due primarily to lung involvement. So therefore, oxygenation becomes poor, saturations drop, and sometimes people die because the lung disease is too severe. But as a liver specialist, I have often been struck by the effect of COVID on liver disease. I'll give you an example. We have a 1.5 year waiting list for liver transplants. So if somebody needs a liver transplant, I have to put them on the waiting list if they don't have any family that can donate. And when a cadaver liver becomes available, he will have his transplant. And the normal waiting time is about 1.5 years. So everybody with liver disease who gets a phone call from us saying there is a liver available, please come for a transplant, they are happy beyond doubt, in unbelief and great joy. They run to the hospital. But approximately 4 months ago, we had such a liver, which is happening very rarely nowadays with COVID. And when we called patients, 3 patients who are on our waiting list actually said, "Doctor, I'm too scared of Corona. I don't want to come in for a transplant." And they refused these rare livers. And in fact, that night, that liver was not used by anybody in Hyderabad. That's a shocking waste of a liver. And for that patients or those patients who refuse, I am not sure whether we will be able to find a liver for them before they die of complications. So this is one effect of COVID, the fear factor, which is obviously due to the facts of what has happened so far, but it has had an effect. Another effect is more practical. I had a patient from Bangalore who had severe liver disease, and we were trying to manage him via telephone calls and advice on the phone and on written messages, etc. But he was deteriorating despite that, and normally we would have brought him to our liver ICU where we can control everything and try and get him better. But with the travel restrictions and the difficulties with flights, etc., it was simply too difficult for him to travel, and he could not travel. And a few weeks later, unfortunately, he deteriorated and then died. So I was thinking, my gosh, COVID directly has produced so much of deaths in the country, but indirect deaths because there was available treatment, but the patient could not reach the treatment. I don't know the number of deaths such as that. I don't think anybody has actually counted. But I can tell you, in the world of liver disease for about 1.5 years, we have done very limited number of operations. And therefore, it must be that many of these people who would have had curative surgery are now not getting that operation. Another very significant aspect of liver disease is liver cancers. And when liver cancers happen, there is only a certain time before they become inoperable, before they become too advanced. And within that time, we do need to do these operations. And in these 1.5 years, I can tell you that I have done half, or not even half, 1/10 of the operations that we do normally for liver cancers. And I'm thinking, all the remaining liver cancer patients must be sitting at home quietly dying because they're too scared to come for tests. They're too scared to do investigations that helps us diagnose liver cancers. One more sort of tragic story I've seen is, there is a patient of mine. We did a transplant on him when he was only 7 months old. He was one of the smallest liver transplants ever done in Hyderabad. His name is Vishal, and he developed sudden diarrhea. And he is only 2 years or 2.5 years old now. And his parents, who are normally very, very careful, would have brought him to our hospital within 1 day if there is any problems normally. But because of COVID, they didn't. And 2 days later, he was admitted as an emergency in acute renal failure because of dehydration following the diarrhea. So this is one more episode where normally with a little bit of water and fluids and maybe antibiotics to control the diarrhea, this would have been controlled, but this poor child had to stay in ICU before he got better. But by God's grace, he did get better, and he has gone home absolutely fine. His liver is also working fine, which was transplanted 2.5 years ago. But with these few stories and episode or anecdotes that I have told you about, I feel that there is a huge impact of COVID on non-respiratory, on non-COVID illnesses that we haven't seen yet. I hope and pray that there is no third wave that comes on to us, and that we would be able to get on with more normal treatment of liver disease, and patients with other diseases are not harmed by both the practical difficulties and the fear element around this pandemic.
We'll be covering all topics which commonly affect patients on a day-to-day basis.
For more this type of doctor advices or opinion or any other things,
దయచేసి డాక్టర్స్ అడ్వైస్ ఛానల్
లైక్ చేయండి, కామెంట్ చేయండి, షేర్ చేయండి.
సబ్స్క్రైబ్
to this channel, Doctor's Advice.
10 మందికి ఉపయోగపడేలాగా చూడండి. థ్యాంక్ యూ సో మచ్.